Hi everyone! Today we'll be talking about HIV/AIDS in pregnancy. Did you know that a woman living with HIV can have a healthy pregnancy and give birth to a baby who is HIV free? Yes. HIV is no longer a death sentence, even in pregnancy, if the right steps are taken early. Today, let's talk about HIV/AIDS in pregnancy. What does it mean? How it should be tested, managed, and how transmission can be prevented. What is HIV/AIDS? HIV simply means human immunodeficiency virus. It attacks the body's immune system. If HIV is not treated, it can progress to AIDS, which is the advanced stage of the disease. A pregnant woman living with HIV can pass the virus to her baby, yes, during pregnancy, during labor and delivery, or through breastfeeding. But the good news is all this can be prevented. How is HIV testing done in pregnancy? HIV testing is actually a routine and very important part of antenatal care. During the booking, the woman is tested. Every pregnant woman that's tested negative will be counseled on how to remain negative. For a positive case, treatment is instituted immediately. The early testing saves both mother and child. How is HIV managed in pregnancy? A pregnant woman that tests positive for HIV will start her antiretroviral drugs immediately. These drugs will help to reduce the amount of virus in the body and also make the woman to stay healthy. Likewise, protects the baby from the infection. So with proper treatments, the risk of passing HIV to the baby can be reduced to less than 1 to 2%. Also, regular monitoring, regular antenatal care visits, and medication adherence is very important. Let's talk about the prevention of mother-to-child transmission. This is actually the biggest successes that we've achieved in modern medicine. Early antenatal visits, registration, HIV testing for pregnant women and their partner, the strict use of prescribed antiretroviral drugs, the safe delivery processes, appropriate infant feeding counseling, HIV testing, and follow-up for the baby. All these steps are very important, and when they are followed, most babies are born HIV-free. Let's talk about breastfeeding and HIV. So we have guidelines depending on the national guidelines and the medical advice we are following. But in this part of the world, we ensure that mixed feeding is not initiated. It's either you're doing infant's formula or you're breastfeeding. You don't mix the two. So also, how do we prevent and control HIV in our community? The first thing is for you to know your status. Know your HIV status. Encourage early antenatal care. Reduce stigma and discrimination. Support people that are living with HIV. Ensure that access to testing and treatment is easy. HIV thrives in silence. Education and compassion is very important for us to stop this virus. So I would leave you with this. Let us spread knowledge and not fear. Let us support every woman living with HIV in pregnancy. Let's protect babies, and also let's team up to end mother-to-child transmission of HIV. Till I come your way next time, I remain Dr. Sene Oluwatosin. Bye.